All right, so as we discussed in the clinic, we're gonna go over different ways that you can alleviate some sciatic nerve pain, especially that sciatic nerve pain that goes into your butt cheek. So Daniel's got a lacrosse ball in a pillowcase, and the reason we have it in the pillowcase is because we don't want that ball squirting out. So just for the sake of this video, we're gonna do this soft tissue work on Daniel's right hip. So Daniel, go ahead and lay on your back. And in the clinic, we already talked about where your sacrum is. We already talked about where your hip bone and your greater trochanter is. Daniel, you're gonna take your right ankle and put it on your left knee. And then you are gonna roll to your left to expose that tissue. And again, we went over this in the clinic. Daniel, you're gonna rotate back onto the ball until you feel a trigger point that's about a 6 out of 10 pain. We don't wanna go any higher than 6 because then your brain isn't gonna relax that tissue. And this might take 30 seconds, it might take 15 seconds, it might take 10 seconds for that soft tissue pain to now become a 3. When it becomes a 3, you can roll back onto it to put more of your body weight on it until it gets back to a 6. And then you're gonna wait however long it takes to get back to a 3. And we're gonna work multiple spots along that tissue from the sacrum to your hip bone. And again, we talked about that in the clinic, those landmarks. So that's a good way to do some soft tissue on your rear end. So now we're gonna do some stretching and some traction to that hip to loosen up your joint capsule. So Daniel, go ahead and grab that thick green band. This band, if pulled super tight, can go anywhere from 65 pounds to 85 pounds. And what Daniel's doing, he's putting it as high up into his crotch as he can so he's close to his joint. And then you're gonna go ahead and kneel down, switch legs there, bud. Good. So he's got that leg up, and that band is pulling him a little bit posterior and a little bit lateral, so he's gonna actually turn his pelvis a little bit to the right. So it's kind of pulling it backwards into the side. And Daniel, slide your left foot in just a touch. Good. Now, you're gonna drive that knee towards the ground, toward your opposite side this way, and go ahead and let that heel come off the ground too. Good. Now take your hand for a little bit of overpressure and push it. There you go. So we're gonna drive that knee down towards the ground. That back side of his left hip is really getting stretched and pulled laterally and posteriorly. And we're gonna try to hold this for 2 to 3 minutes. Okay? Daniel, go ahead and go on your back, leave that band on your hip. This is gonna pull him straight down that way. Daniel, you're gonna bend your hip to 90 degrees. Go ahead and lift it up, grab behind your knee. Good. Now, grab up a little bit higher on your knee. Good. Now, that's all he's gonna do. He's gonna keep his knee on that vertical axis, and he's gonna bring his foot internally and externally. And we're gonna do that for about 2 to 3 minutes and let all that tissue sort of unwind. That's great. Now, you're gonna step your foot over the top of your leg there, so step it over. Good. Now, I want you to rotate your body towards me. Good. Now, bring that foot as high up as you can. That's perfect. So he's got a really good stretch going there. To enhance that stretch, he's gonna just let his left shoulder fall to the ground. And if you wanna get even more of a stretch, you're gonna let that left knee go more towards the window there. There you go, yeah, so that's a really, really good stretch. Those 3 stretches are joint capsular stretches, and you're gonna get some soft tissue stretching too, but this should help to alleviate a lot of sciatic nerve pain.